Now we're going to address some of the frequently asked questions received by NASW and the Social Work Board. One of the most frequently asked questions is, can an LMSW own and operate a private practice and hire a supervisor, a clinical supervisor?
This is another one of those situations that has changed over the years based on the fact that social work was title protected only and the scope was not defined or restricted before 2004. So that prior to that date, any individual could go out and open a business and provide psychotherapy, including a social worker. When the law changed and established scopes of practice, an LMSW can practice that profession independently in their own practice, and that but they cannot provide clinical social work because they can only do that under supervision. They cannot employ a supervisor or anyone else who reviews their cases with them. They'd have to be in a setting owned by an LCSW and employed by the LCSW, or working for another qualified individual or an organization. Okay. Now, we knew that this went on before the law took effect, and because it's so difficult to reach out to more than 20,000 licensed master social workers who were out there practicing, some people didn't get the word. So we found when we were reviewing applications that we needed to address that problem. At my recommendation, the Committee on the Professions within the department authorized us to allow an individual who had set up a private practice as an LMSW to provide clinical services, or who had employed their supervisor when they worked in another setting. If they started that before February of 2009, we're allowing them to continue that to completion, which would be February 2015, 6 years at the most. We're not allowing new people who come out of school to set up this, because that's not the way the law is intended, and that's not the way the legislature wants to ensure that people who are providing psychotherapy services are independently licensed and authorized to practice that profession.
Okay, so no LMSWs that should be engaging in their own private practice after February 2009. Okay, great. Now, as we mentioned earlier, an MSW who does not pass the examination can provide certain services, but not clinical social work services. Can you tell us more about what kind of tasks they can do without licensure?
The education law provides for an exemption for a person with a bachelor's of social work degree, which is the entry into the profession, and a person to be able to provide certain services that are defined under law as within the practice of licensed master social work. NASW and others came to us over recent years and said, well, what about someone who does not pass the exam and has got their MSW degree? Can they essentially function as a BSW? We looked at that with our attorneys, and the determination was yes, that made sense. So in 2010, the regions amended the regulations to state that an individual with a BSW or an MSW degree can engage in the administration, community organizing, the planning, the activities that are part of the licensed master scope of practice, just not the clinical social work or the supervision of clinical social work or any type of administrative supervision. And of course, they cannot use the title that's restricted under the law in 7702.
Okay. And are there any other exemptions under social work licensing?
Because social work licensing came along in 2002, when for decades organizations and individuals have been engaged in activities that would now be restricted, the legislature recognized that there was a need to try and allow unlicensed people to continue performing tasks that they were performing, even if those overlapped with the scope of practice. So Section 7702 of the education law actually provides a list of activities that could be performed by a licensed master social worker, but that these activities in and of themselves do not require licensure. These could be administration, planning, running a community program. It could be research, evaluation about services that are provided. It could be community organizing, working to turn out the vote, engaged in activities that we typically consider as working with the community to empower that community. It can include things like helping people get access to services that they need, case management. So the case management, while it can be done by a social worker and it can be part of social workers' practice, you don't have to be licensed to provide case management. So this makes the social work licensing law unique, not only among the professions here in New York, but also in terms of social work licensure across the country, defining activities that, while can be performed by a licensee, don't require licensure.
Okay. And what about other professionals who may be exempt from the law?
Well, there are provisions in the law to provide an exemption from licensure, which means an individual can engage in the activities that would be restricted, but they can't use the title. So, for instance, there's exemptions for students who are in programs approved by the department as a BSW or an MSW program. There are exemptions for other professionals, individuals in nursing, medicine, mental health counseling, psychology, professions that overlap with the activities of licensed masters and licensed clinical social work. For individuals who are credentialed, for instance, as a KSAC, an alcoholism and substance abuse counselor, who works in a facility authorized to provide substance abuse services, but does not work outside and does not hold out to the public as being able to provide substance abuse or alcoholism services. So all of these exemptions allow people who are either other licenses or other credentials to provide those services. There's also general language that says an individual, a business, a not-for-profit, a church, a school, a teacher can engage in activities that might fall within the definition of social work, but as long as they're not using the title, they're not holding out as if they are licensed in any profession, they can provide those services. Again, the legislature tried not to disrupt what goes on in the communities while allowing people who do provide social work services to provide those appropriate services.
Okay. And Karen, many social workers are employed in agencies that are either operated by the state, such as an OMH facility, or issued an operating certificate by the state, such as hospitals, clinics, and residential programs. Can you discuss the exemption from licensure for these settings and what it means for individuals who may be seeking licensure as an LMSW or LCSW?
Yes, this has been actually one of the biggest issues and probably has received the most amount of attention from both our members and non-members alike. Prior to enactment of the social work licensure statute, a number of state agencies requested an exemption from the provisions of the licensing law, and that exemption was granted to the Office of Mental Health, the Office of Alcoholism Substance Abuse Services, the Office of Persons with Developmental Disabilities, local mental hygiene districts, and as well as local social service districts. That exemption, the original intention was that exemption would remain in place until January 1st of 2010. However, there were a few implementation issues still that needed to be worked out. So we've worked with the State Education Department and the legislature to provide for an additional extension to July 1 of 2013.
Okay. And I would add that one important note about this component of the exemptions is that the exemption applies to the setting and not the individual. So should an individual be practicing in an exempt setting without a license, if they were to go to another agency or another setting that was not exempt, they would have to be licensed if they were doing tasks within that scope of practice.
Correct. The exemption doesn't follow them.
Right. Okay. Just wanted to be clear on that.